30 years ago, my mom delivered my brother via VBAC after having me and my sister via emergency C-sections. So most of my life, I grew up thinking that anybody that wanted to have a VBAC could do so. But as I got into this birth space and I really started specializing in women's health, I realized that this was really not the case. Many women aren't even told that VBAC is an option for them, and some women that want a VBAC are not supported by their birth team. And so I want to make sure you have the information you need to make a very educated and empowered decision when it comes to your wishes and desires when it comes to your birth. So I have invited a special guest onto my channel today. We are going to be tackling some really hard questions like, who is a good candidate for a VBAC? How do you find a provider that supports a VBAC? Who do you need on your birth team if you want to have a VBAC? What are the do's and don'ts for someone that really, really desires to have a successful VBAC? I'm so excited for this video today. Let's dive in. Carrie is actually a DONA certified doula. She also, I better get my notes out here to make sure I say this right. She's also certified through the VBAC link and is a VBAC specialist and educator through the VBAC Academy. So tons and tons of experience and education with VBAC. She's also delivered, or I guess not delivered, but assisted or been present for the delivery. Right. She's been present at the delivery of 118 babies now, which is amazing. And so she's just a wealth of information, and I'm so thankful you're here, Carrie, to share all your information with us today.
Thank you so much for having me. I'm really excited to be here. I love the work that you do, and I often refer my clients to you or to your, your YouTube channel and everything. So it's nice to be here.
Well, thank you, Carrie. Before we dive into my first question for Carrie, I really wanted to make sure everyone knows what a VBAC is. A VBAC, quite simply, is just a vaginal birth after a C-section, and although that can look a little bit different for everyone, that is the basic concept of a VBAC. And I think some women are out there thinking, I've heard of this. Is this something I should consider? I want to know more about it. And so my first question is, who is actually a really good candidate for a VBAC, Carrie?
So personal opinion, most people are. Majority of women are good candidates. When you look at like the medical side, like the obstetric and midwife side, sometimes they're going to be looking for somebody who has had one or two prior low transverse incisions, so the incisions that go straight across the bottom versus up and down like this. They're looking to see that the reason for prior cesareans are not reoccurring issues with the mother. So it's better for it to have been an issue with the baby, so that either heart decels, baby's positioning, or they breach or transverse or asynclitic and things like that. Those are much more favorable, is the word that they say, that it isn't something that was with the mom. So they'd rather have seen it than an issue be with the baby being in that. Those are really kind of the primary things they start to look at. There are things that they look at like BMI, which we actually did a podcast about, which shouldn't be like a huge factor into it. And there's something called the VBAC calculator, which is going to look at your age, your height, your weight. Mainly they're looking to see if there was a failure to progress. And I hate to say that term. And that can happen for multiple reasons. And the VBAC calculator isn't really a accurate portrayal of your true chance, because most women that choose to go on and plan their VBAC are successful. They say it ranges anywhere between 60 and 80%.
Wow.
Unfortunately, less than half of the women that are candidates for a VBAC even choose to. Somewhere down into like the 30% range actually is, why they are the ones that choose to. And that can be for multiple reasons. It can be personal. They might just decide that they want a repeat C-section, and that's 1,000% okay. It can be hospital policy. Insurance and hospital policy drive hospitals and what they do quite a bit, and providers. Yeah. And it can also be provider bias in language too. If you're not thoroughly educated on it, you don't really know what's the best for you. And VBACs are, statistically speaking, safer than a repeat C-section. So not only are there shorter recovery time, it's more cost effective. Women have a much bigger role in their delivery, which I think is really big for a lot of those that are planning for that, but there's a lot of lacking in education in our healthcare system. And unfortunately, we have providers that want to educate, but our healthcare system just isn't built for that. I really think anybody is a good candidate. It's really about finding the right provider.
Yeah, I heard just recently that there's a local hospital that isn't even like offering that as a choice to women, which is really unfortunate and sad considering that the evidence that you just told me about and the research that's showing how effective it can be and the benefits of it. So that's really too bad.
The American College of Obstetrics and Gynecologists, they have a study, or it came out in 2017, that gives the recommendations for it. And it shows that most hospitals should be able to support a VBAC birth. However, hospitals, they have the right to further restrict, and that's where the policies and liability and things start to interfere, unfortunately.
And I think that leads right well into my next question, which is that a lot of times when I talk to women, they might say, my provider told me I'm not a good candidate for a VBAC. And, if they're totally fine with that, it's not something that I'm like, well, you need to pursue something else. But if they're like, I really was hoping for a vaginal birth, it used to be, I would say like, well, maybe you should get a second opinion. But I think that very commonly, if they seek out a second opinion, especially within the same system, they're probably going to get the same answer, whether it's a midwife or OBGYN. And so what are different things that they can look for in a provider that might make it, might increase their odds that the provider is going to be up for trying a VBAC?
One of the biggest outcomes for an individual planning a VBAC success is going to be location and choice of provider for this. There are some practices that they all have very much the same viewpoint, but sometimes in some practices, you kind of get those outliers that are more supportive. So when you're looking at when you're asking questions, or you're looking to see if they are non-supportive or friendly. Sometimes they say tolerant. So in asking questions like, do you require that I deliver by a certain time? A lot of non-supportive or tolerant are going to say, we really like to see you go into labor or deliver by 39, 40 weeks. Some women will go into labor before that, but
yeah, that's never me.
Versus, hey, there are no time limits for labor to start. They refuse to induce, versus somebody who may look at a gentle induction, and inductions are different for those that are VBACing, where they heavily rely on the VBAC calculator for chances of success and what they recommend. Depends on the provider and the system that they're in. Like I know personally, locally here in Grand Rapids, based on liability and what they have to say, if it's the scores below 60%, that it's not recommended. They're not saying you can't. Okay. Which is really important.
Yeah.
Knowing around here, and truly it is just a number. I think women and those that are planning their VBAC really just kind of need to take that number with a grain of salt. We already know that the VBAC calculator is racially biased. So it plays in your BMI to it, which we know that, yes, there are health risks with higher BMI, but it should not be the sole indication for not having a VBAC. Is that provider only talking about the risks of VBAC, but not talking about the risks of a C-section? Because it's actually a higher rate of risk for complications for a repeat C-section. Is there equal discussion about it? Again, that trying to educate. You can try to ask their VBAC or rate, or what their C-section rate is. Yeah. Some providers really truly don't keep stats on that. They might actually have to find something in the office. Another good thing is that they're looking more at your medical and birth history type thing, versus as being like, oh, your hips are too small, or I think your pelvis is narrow, things like that.
Yeah.
And unfortunately, sometimes you get the talk of them being very supportive in the beginning, and then you start to get to 37 weeks, and it's kind of like a bait and switch sometimes, which is terrible. So creating a very supportive birth team is really paramount.
I think this is a general problem with the healthcare system surrounding childbirth. Not to go on too much of a tangent here, but I've had, two different experiences. One with induction, where I right away asked about induction, and they're like, oh, it's going to be fine. And then when we got to that point, they were like, oh, but you need to deliver by this date. So we're actually going to induce much sooner than what we said what I had perceived as when I would have to deliver. And then I have not had a C-section, so I'm not really familiar. But when does that conversation happen? Does it happen right away? Because I think sometimes people feel like, well, I'm so involved with this provider, it would be weird to switch now. Does this conversation come up right away at one of your first prenatal visits? Or is this something that you might not even have this conversation until you feel like you're too far into it?
I find that it tends to come up pretty early.
Okay.
And the pregnancy, sometimes providers bring it up. So you're a great candidate for a VBAC. I'd support you in that
Okay.
if that's what you want. I understand, like, oh my God, if I have to switch, I don't want to switch. I don't want to hurt their feelings. And we really need to get over that.
Yeah.
Because they are not birthing this child. They might not even be there when you have that child. It could be somebody else. If you feel that their goals are not aligning with you, that it's okay to look elsewhere. Like I said, they can't be the ones to have your baby.
Right.
And it shouldn't be a struggle or you feel like you are settling, for a birth experience that you're hoping for.
There's so many other things in life that if we're not satisfied, we go to the grocery store, they don't have the things we want, we'll easily switch. Or, a salesperson, or, well, I don't like how they treated me, we'll easily switch. But for some reason, when it comes to medical staff, we have such a hard time switching, I think. We just feel so bad about switching. To really expand on something you said a little bit ago was your birth team matters. And so I think you were alluding to the fact that sometimes you can have the best plan in your mind, like this is how I want it to go, but unless you have done the prep work and have the right people on your team, sometimes that plan doesn't happen. And so who else would you recommend having on your birth team if you really are hoping for a VBAC?
Okay. And this is something I generally, with all clients, I recommend these as well, but they're sometimes a little extra for those that are planning their VBAC, just because sometimes there is an element of trauma with their previous C-section or other things. Chiropractic care, I think, is huge, starting early in that. It's about being proactive with your body work, not reactive. Don't start going like a month before you're having the babies start, that second trimester on, because they're very good at, creating that balance in your body, the pelvis, helping with uterus, ligaments, and all of that stuff. I love prenatal yoga or other type exercise-based programs. Yoga is really good, physically for your physical health, but also that mental, emotional side, breathing, because it's very similar, the type of breathing we like to see when you're in labor. But I encourage you, like, don't change what you normally do unless there's a medical reason for it. There's really no reason to stop doing what your normal workout routine is until it's either too uncomfortable to do and you have to modify it.
Yeah.
But still staying physically active is actually a benefit to you and baby and your labor. I love pelvic floor therapy.
Yay.
So it doesn't matter if I was actually talking about it today with my neighbors, whether you've had a vaginal birth or C-section, majority of women that have been pregnant, or anybody that's been pregnant, can really benefit from pelvic floor therapy.
Yeah.
To help with weaknesses, even to help with pushing type things can be a huge benefit. I'm big on childbirth class.
Yeah.
Good childbirth classes, the ones that kind of go over the anatomy and physiology of birth. I think it's really important because, again, we're very lacking in our system for education, that most of us don't even fully know what our body has to do to have a baby.
Yeah.
Besides dilate and pushing. Yeah. And there's more to that. And I think knowing it can help reduce a lot of the anxiety that comes with birth. And again, part of that mental and emotional preparation. And for some of my clients, I recommend seeing a therapist or a counselor based on their prior experience. It's very common for a VBAC birth to get an emotional block during labor, especially if the labor they're having now currently is similar to previous ones. Yeah. And working on like fear release activities or through that trauma with a counselor before going into it, if they're comfortable with it. And then the last one is a doula. Doulas are that continuous support that most hospitals cannot provide. They are educated on body work and how to help with natural comfort measures, how to help with repositioning a baby, how to get things to progress sometimes more quickly. Um, and again, doulas are really good at bridging the education, or at
Yeah.
least that's what I perceive as one of my biggest roles as a doula is bridging that educational gap.
Yeah.
So my clients, when they do come in, they are much more well informed for when it comes to making medically based decisions, and that they are ideally more calm, more confident in their ability to birth, to
Yeah.
maintain a coping mindset, as well as their support person.
There's two great benefits of the doula, and I just actually talked about this with another doula, is that one, you're not employed by the hospital, so you don't feel like your job is on the line if you recommend something, or not recommend, but are advocating for something that the patient wanted that doesn't line up with what the provider wanted. You're not afraid you're going to lose your job. So I think that makes you a little more bold. And also having that professional that is educated that can reaffirm my thoughts, because sometimes I can do all the research and be totally prepared, but I want someone else that I know as an expert in that to put their stamp of approval and say, yeah, you're thinking that through clearly. That's right.
It's true. It's nice. And ideally your doula's face never changes throughout. So that role again of letting you know when this is normal. This is a normal part of birth, or X, Y, and Z might come in if this kind of happens too. We realize we're not medical professionals. Most of us don't want to be medical professionals. This is why we're doulas.
And I wanted to, just because I can't let the pelvic floor go by without saying my comment about it too, but just a plug of like, if this, obviously a VBAC, you've had a birth before, and there's tons of things we want to make sure are healed before you go into your second birth. And people just don't realize the benefit that physical therapy can help with during pregnancy. And not even all providers realize that. And sometimes it's hard for a patient to get that referral, but there really are a lot of things we can do. And after going through all my public health training, I realized that like the physical therapist was actually the person I was looking for. Like I wanted things done during my pregnancy, but I didn't know who the right professional to help me with those things were. And a chiropractor and a physical therapist are going to be like your main people to make sure your body is ready to deliver too. So definitely agree with you on that.
It's something that I feel like when my daughter is of childbearing years, like 20 years down the road, I feel like or I hope that it's more standardized care when it comes to pelvic floor therapy. It's like, okay, you've got your 6-week appointment here or 2-week appointment here, and then, we'll make for the referral for pelvic floor therapy at this appointment, that type of stuff.
Yeah, that would be awesome. Other countries are ahead of us on that. So hopefully we'll follow suit in the future. Being a doula that has been at exactly 118 births, I'm sure there are lots of things that you have seen women do that have worked really well, or things that haven't worked so well. And so if there is a mama hoping for a VBAC here, what are 3 things, if you can limit it to that, that you would highly recommend mom do either during pregnancy or labor and delivery to make it the most chance that she's going to have that successful VBAC?
Number 1 is the provider. Find the provider, switch your provider. Don't settle, for subpar care. Now, some individuals can't because of where they live. Geographically, there isn't that. So which kind of leads into number 2 is educate. Educate yourself. Whether that is through, going to credible sources, evidence-based articles that show you true facts and statistics of things. So when you have a discussion with your provider, I like to fight with facts instead of emotions. It makes it a little bit easier sometimes. And sometimes that education piece is having a doula helping with the education. Though a lot of doula trainings don't educate on VBAC. It's kind of an additional interest that they have and take time to go through it. And I'd say for birth, like in the moment, movement, your breathing, and if you can, waiting to go to the hospital a little bit longer, until, I don't ever want anybody to push them so hard that they are in a state outside of their mind. But the longer you can wait to go to the hospital, there's a lot of benefit to it.
I think this is something that I don't know if it's from TV shows or where we got this idea, maybe because monitoring is a big part of hospital births, but people just feel like you labor in the bed and that's it. And even in the bed, there are ways you can move around and stuff. But I just think it would be cool to get a new mindset of like, when I go to the hospital, I'm not restricted to my bed. I can walk around my room. Most times you can walk around the halls. Like there's lots of options. It doesn't have to be the norm to just be stuck in bed and wait for your baby to come out. So that's a really great one. I love that.
Usually one of the things I highly encourage, because sometimes when I'm hired on, they don't have the provider yet, or they aren't set yet. And like me knowing the area, I can tell them. But if you aren't from the West Michigan area, is, asking the hospital, do you offer wireless monitoring? Do you have bathtubs? Things like that are just really super helpful things to help labor progress more naturally with less intervention if needed, less medical type pain relief. These are all natural measures that really help. So these can help sometimes knowing those. So ask those questions.
Beautiful. And then if there are 3 things that women should not do if they want to have a successful VBAC, are there any 3 things to avoid?
It's almost like the switch of the things that you do. The not moving in labor is probably one of my biggest things. And this is hard sometimes, because if it's an induction, it's not the same labor as if labor happens spontaneously. So I would say if you can try to go into spontaneous labor versus an induction outside of a medical indication for one, that would be the best. Not doing some of the emotional work. Sometimes it's that when there's like an emotional shutdown, and it still can happen if you go to counseling and seek that out. But it's hard sometimes when there's this emotional shutdown and labor kind of stalls out, and they're trying to process things, and which is fine. It can be a part of labor, but again, not changing provider, but more so because of things like you're scared of hurting their feelings, or they tell you how difficult it's going to be. You have a right to change at any time. The system does not always make it easy for you, though. So you have to learn to be a better advocate for yourself. And that's really hard in a system where we're really taught to listen when it comes to medical care.
Research, I know what I want. I'm usually a very stubborn person, but I feel the same way a little bit when I get in front of medical providers. I just kind of melt. And so sometimes I've found taking my husband to appointments helps, because he can be that person on my team that's like, well, didn't you say this? Or, give me the courage to say those things, which I know is another role that you play as a doula. So getting your support team to kind of know your wishes and then back you up can be really helpful too. I want to, because I've been talking about home birth a lot in this channel, and I'm planning a home birth, and I want to know, I genuinely don't know the answer to this question. Is a VBAC ever a candidate for a home birth?
Oh, yes, 1,000%.
Okay.
So it's called HBACs, home birth, after cesarean. Okay. So, there are, at least in our area, there, majority of those midwives are more than happy to support a low risk pregnancy, for a home birth. Okay. So encourage, if you're looking or thinking about that, interview several midwives out in the area. Ask, how many they've done, how comfortable they are with it, what it looks like if things are happening, and what does a transfer to a hospital look like, and does that entail, can they come and in there and support emotionally? They can't support on the birth side once in a hospital, but these are important things to know. But yes, HBACs can be beautiful things, and I haven't been able to see many of them, but it's yes. A home birth is outside of the realm of a possibility just because you've had a prior cesarean.
Carrie, I know me and you could really dive down a rabbit hole of research. We love that sort of thing. We love to dive into it, but some people are just looking for a cheat sheet. So I want to point those of you watching that are like, I really want the Cliff Notes version of the research to support my VBAC. I want to point you to one, Carrie's podcast. It's called VBACed. I'll put a link in the description below so you know exactly how to spell that. Or her website, gingerblossomdoula.com, where she provides tons of information, and there will also be a way to contact her directly right on the website. She also has included some links to some research, some very reliable resources about VBAC specifically, and I'm going to throw those in the description below for all of you. If you're watching and you're like, I really just want to learn more information about doulas in general, I'm going to point you to this video over here. It'll be really, really helpful for you. Otherwise, I want to say thank you so much, Carrie, for being here, for taking a break from your busy doula life and mom life to share with everyone. I can't wait to see everyone in the next video.